Good morning and welcome everyone to the Coalition of Orange County Community Health Centers Coffee Connections event. It's wonderful to have you all here today. I really do welcome you all and thank you for joining us today. You'll see on the slide, it still says Isabel and I'm clearly not Isabel. So I'm Ryan Yamamoto. I'm the Chief Operating Officer with the Coalition of Orange County Community Health Centers. And thank you for joining us today for our Coffee Connections, really thinking about scenario planning for our safety net organizations. For those of you joining us for the first time, we're an organization, a membership-focused organization that represents the interest of our community health centers in Orange County to serve our community's most vulnerable patients. We represent 20 community health centers and one nonprofit organization here in the county. Our health centers operate over 90 locations, provide over 1 million visits to over 240,000 patients annually. So to put that a little bit into perspective, that's approximately, in terms of our total population of individuals on Medicaid, it's about 1 in 3. So a lot of people don't think about Medicaid patients, especially having that large of a number in the county of Orange, but that's actually 1 in 3 residents that actually is on some sort of public support program. So it is quite high. Today, I really want to start by thanking those who made today possible, to all of you for attending, for showing up, your commitment to equity, and for engaging in this important conversation. Today's speakers for lending their expertise and insight on a vital topic that is imperative to all of our nonprofit organizations as well as our community health centers. And then to our community health centers and partners, thank you for your dedication to our community and their health. It really is a heart of the work that we do. And then lastly, to our students and emerging leaders, your energy and passion are the future of healthcare. At this time, I also want to recognize our staff in the room for all the work that they've done. This takes really a village to kind of set this up and to kind of complete this on a quarterly basis. So thank you all for our staff, and thank you guys for everything that you do to make sure everything goes well today. Today's event is being recorded. It will be on the Coalition OC's YouTube channel so that others can benefit from the insights and the information that is shared today. If you haven't seen it, it also has also clips as well as recordings from our previous Coffee Connections also on that page, so you're able to kind of see it and view it. There is a significant cadence where these happen quarterly, so they're all posted there for your review. So we want to really make sure that we create a safe and inclusive environment. Together, I think we want to commit to a space where everyone feels welcome. We want to make sure that obviously inappropriate behavior and our comments will not be tolerated. And we're just trying to create a respectful space. We want to keep our conversation professional, respectful, and ask that all of you participate fully, thoughtfully, and avoid offensive, discriminatory, and disruptive behavior. We will be having a Q&A session, and at that point in time, please raise your hand and we will have individuals running mics to you so everyone can hear the conversation and actually gets included in the recording. So with that as well, you see on the table there is a flyer that's posted there that has a QR code that's listed there for all materials pertaining to the speakers and their presentations. Will lead you there, as well as a short survey. That survey is really, really important. I really encourage you all to fill that out. We really do love the feedback. We want to use that feedback to make these events better. These have been on an evolutionary track where each one gets better. We change the format a little bit, trying to make sure that we accommodate the needs of everyone in the room. So we just want to make sure that we're respectful to that. If you have any comments or feedback, we really would love to hear it. So again, the QR codes for both the presentations and the evaluation are on the desk. On the table. That really does conclude our housekeeping and our reminders, and I really want to then focus now on our this morning's dialogue and really about navigating care in uncertain times. Scenario planning for safety net organizations couldn't be more timely. Our providers are operating in a healthcare environment defined by volatility, uncertainty, complexity, and ambiguity. Federal budget cuts, shifting Medicaid and Medicare rules, executive orders, and the weakening of long-standing public health infrastructure. Most recently, if you look at the CDC and what's happening there, These are all converging in ways that really do threaten access, equity, and sustainability. Layered on top of this is a climate of fear, I think, that's heightened by immigration enforcement, ICE activity, and what that then causes at the end of the day really is individuals and families either delaying or avoiding care altogether. It even affects staff in our health centers. They're worried about their loved ones, and they themselves may also be directly impacted. And so I think as we think about the sharing of information about beneficiaries furthers erodes the trust that has been really in a lot of ways. Our health centers have been those centers of trust, have been those safe places of refuge, and now even that is being threatened. Um, we have done nothing as a health center, as health centers or providers to really break that trust. And first, we must obviously continue to rebuild our trust with our communities so our communities and individuals feel safe in seeking care. And secondly, maintaining that continuity of care and services as we navigate through fear, policy change, and those resource constraints. And I just want to point out that we've faced difficult moments before. This is not the first time, it will not be the last. I will say that, however, the pace and the complexity and the stakes of this moment are something that we have never seen anything in like. These realities have really forced us as a safety net to really think about how we operate, adapting our services, expanding telehealth, delivering food directly to homes, or even reevaluating whether it's safe to hold community events together. I think what connects us all is really just both a responsibility and an opportunity to stay nimble, people-centered, and collaborative as we face these challenges together. We're already grappling with rising costs, workforce shortages, growing community needs. That's why I think today's focus on scenario planning is so important. This isn't just an exercise in organizational survival. It's really about creating an intentional direction and thinking about charting the health for our patients and our workforce and our communities moving forward. I think even more so now, every decision matters because this choice has real consequences for our organizations, our staff, and our communities. Scenario planning, if those of you have never really engaged in it, it's never easy, but extremely vital to this process, especially now. It gives us the tools to prepare for what's coming, but also to steady ourselves in uncertainty and really sort of creating a space where you can reimagine how care can be delivered in the future. I think it gives you also a roadmap to kind of lead you down this path and helps you not stray from that path and helps you, I think, accomplish all of our missions. And at the end of the day, it gives our mission that we all share, I think, renewed meaning. Our events are designed to be more than just conversations. They're spaces where we can really step back and from a day-to-day connect with each other, engage deeply in the issues that really do shape our work and our future. This morning, we're going to ask ourselves, what's probable, what's possible, and more importantly, what's preferred? We'll ground ourselves in the current landscape, then move into a scenario planning session designed to clearly equip us with the tools, frameworks, and ways of thinking that can only guide our organizations to success, but also in our collective work as a community. We'll then finish the day with a live Q&A, so it gives you all an opportunity to ask questions and also to share and hear from each other's experiences as you go throughout the rest of the day. And right now, I want to turn us to the main part of the session, why you're all here to be with us today. As before I introduce our keynote speaker, just remember two things about today. Really, it's about recognizing that these are tough times financially, politically, and operationally. Just showing up here today matters because it means we're choosing to work together to face this uncertainty together rather than do it alone. Secondly, creating a space where we can keep things honest and preparing for today. Warren and our planning team, we really talked about the importance of not shying away from difficult or uncomfortable conversations. Be willing to show vulnerability and of the grounding ourselves in the wisdom and practical tools that we have that can guide us moving forwards. Some of us are Brene Brown fans, and she has a term called courageous leadership means being awkward, brave, and kind. So as we engage today, let's ourselves be a little awkward as we ask really tough questions. Be brave and as we tackle these difficult topics, and as kindness to ourselves and to each other as we learn together. So with that, I am really excited to introduce our keynote for scenario planning today. Our facilitator is Warren Brodine, Managing Director of Delivery Systems at Health Management Associates. Warren brings with him an expansive, vast experience over 30 years in the safety net healthcare arena, has been in the intersection of policy and delivery care in rural populations, and also guiding FQHCs and their affiliate groups in their care design and individual community and system impact. National voice for payment reform, also has focused on needs of patients and communities, advocated for our communities, and also has been involved in the process of health equity and what it means to deliver care in that way. He's always centered in efforts to reduce costs, improve outcomes. Those you may not know, but Warren actually is, formerly president and CEO of Eisner Health, so knows this space really, really well. And as someone of his vast wealth and knowledge, becomes a consultant when he retires. So with that, I want to welcome Warren to the stage, please.
Thank you. It was like the nicest things anybody said about me in one time in a while. Thank you very much. I decided to leave my jacket off and I literally rolled up my sleeves because one, it's a little warm in here. And secondly, I hope we're gonna talk about some things that are tough. Ryan and Isabel and the team asked me to be willing to look at you and ask some questions that maybe other people haven't been willing to ask, and to be bold and to share thoughts and ideas that might come from a slightly different perspective, and specifically not to walk you through a spreadsheet. So I'm happy to say there will be no spreadsheets, no math. We're not going to calculate, assigned but not seen patients, and we're not going to talk too much in pure dollars and cents today. But I am going to ask you some difficult questions and ask you to think about the future in a little bit of a different way. I just did the little pre-interview with your team, and one of the things that Oscar asked me was about Carlos, not Oscar. Carlos asked me about what a student can do in thinking about the future. And my answer was to remember to look at the past, because past is always prologue. And when we're thinking about what is in front of us over the next handful of years as we're navigating some really turbulent times, there's people who came before us who navigated other times of turbulence in somewhat of a different way. And I don't know about you, and I hope you find this at least a little amusing. I am so sick of the word unprecedented that I have this slide that I share with people periodically with a bunch of synonyms that we can use instead of it. So I'm going to ask you to take my pledge, which is not to refer to anything as unprecedented today. And we can put this back up when we're having conversations and you can think about something different. But, words matter, and how we talk about things is important. And I'm afraid that the word unprecedented has lost any of its impact. Everything is unprecedented, right? If everything's unprecedented, nothing is unprecedented. And so, I'm particularly fond of freakish at the bottom. That one seems to get people thinking in a different way. I happen to have an undergraduate degree in French, so my professors would love that I have outre up on the board as well. But today we're just going to talk about a handful of things. A little bit on the state of play, and some of you friends know that part of HMA, we have a team in Washington that is super focused on policy, and so I got some of their up-to-the-minute reads on some things that are going down and happening, so we could share a little bit of that. Talk about how the organizations that you represent, health centers, community-based organizations, health plans, the county, whoever you are, we can approach this moment in a slightly different way. And some thoughts about positioning and response. And then we're gonna have a break, and then the mic, thank you very much. And then we're gonna come back. Let me see if I can tighten this a little bit. Then we're going to come back after the break, and we're going to do a little tabletop exercise. And my colleague, Dina Porchabon from HMA is over here, and some of you know Dina from her work with Coalition. We're going to circulate around and spend some time together, helping you kind of walk through in groups about what are some ways that you might think about responding to these times. So we're watching the world unfold with some pretty big changes every day. I'm gonna take this out because it keeps falling down. And we're watching regulatory, executive, congressional action, HR1, all these, we've watched all this unfold since the beginning of the year, and it's going to continue to unfold. And that's a really important theme, because if we think about past being prologue, lots of things that have caused upheaval in the marketplace that we work in have all undergone considerable and constant change since their enactment. And so I share that because this is not a static and stable environment. It's going to continue to evolve day in, week in, month in, and out for the foreseeable future. The big things that I see that affect our sector are cuts to Medicaid in the marketplace. I don't think I have to tell anybody in this room about the impact that's going to be. Kaiser Family Foundation predicts 1.6 million people in California will switch from covered to uninsured. 1.6 million people. That's a huge number of people flipping over. Ineffective work requirements. You know what? Georgia, Arkansas tried this already. They voluntarily abandoned them. Why? Anyone? They didn't work. They literally did not work. More people did not get employed because they had a work requirement for any type of public support or public benefit. So all this is a talking point. We have no idea where this is going to go, in my opinion. My opinion, not my company's opinion. Every 6-month Medi-Cal recertification, this is just a barrier to help cut the numbers. So I want you to put this one in the back of your mind, because this is actually an area where we as community-based organizations can play. And that's really important to think about that. Remember all the outreach and enrollment at the ACA? Well, you might want to dust off that binder on your shelf, because a lot of it is the same tools and techniques that we were doing all those many years ago with outreach and enrollment. And then finally, all the other stuff, SNAP changes, the executive order on homelessness, National Guard. Some of this is really just designed to create an environment of fear that Ryan was talking about in the run-up, that's designed to create uncertainty within the population. And so there are things that we can provide to our beneficiaries and our patients and our neighbors and our community members and their families that help overcome some of those changes. Everyone compares HR1 to the Affordable Care Act, and it's probably the most apt comparison that I can think of. Because if you think about it, right, the ACA completely overhauled healthcare in America, and HR1 completely overhauls healthcare in America. They really do, they have the same outcome, so to speak, right? Different final outcomes, but they both disrupt healthcare delivery writ large. And if you think about the way they are the same, is that they're these sweeping policy changes, right? They're reshaping Medicaid as we've ever known it before. Lots of authority given to HHS to implement. Put a pin in that one too, right? Because administrations change. So there will be new authorities, just like we've watched the ACA swing and have these ups and downs, and it's different in this administration than it was in the last one. So will the HR1 implementations be different going forward when there is a new administration on 1/20/2029. Both of them were single party passage, more or less. Right? It was one group doing their vision. So that shows you that it's this sort of tranche that's driving that train. And initially, most Americans disapproved in both cases. Right? That's really important. Key differences, right? ACA was a healthcare bill for a popular president. HR1, on the cusp president in terms of popularity. So it's highly different environment, right? President Obama, when passed the Affordable Care Act, had very high approval ratings nationally. It was right around the middle point for the president when H.R. 1 was passed. ACA, cutting Medicare, expanding Medicaid. H.R. 1 brings the Medicaid cuts back down to pre-ACA levels. A lot of H.R. 1 happens in what I like to call inside baseball, and you do not want me to talk to you about provider taxes and SDPs and all that, or you'll be out cold and you'll need a lot more coffee. So we're going to leave most of that to the side today. But remember that the real meat of H.R. 1 is really in what's happening with these provider taxes and how the feds are funding Medicaid in the states. And a lot of that, actually, we're going to leave that to the academic team. They can study that going forward. But that's a super important thing to remember, that it's the stuff in the background, right? How our health plans and provider taxes and how the state-directed payments that fund DHCS here in California, that's a lot of the meat of H.R. 1 and how it gets implemented and rolled out. And then the new burdens on beneficiaries, right? So what do we remember about the beneficiary burden in the Affordable Care Act? Right, everybody was supposed to have a coverage mandate, and that got wiped out. So we have some pretty interesting history to think about in terms of mandates on individuals where this health coverage overhaul is concerned. Some key considerations just for you to think about, and you know most of this is if you think about it, but again, this is all part of the past as prologue kind of approach here. So there is going to be change. This law is going to change before it settles. Of that, we have no doubt. There's going to be litigation, there's going to be new elections, right? We're coming up on a midterm election shortly. That's going to provide changes to the law no matter what the outcome of that election cycle is. New regulation, there will be things struck down, there will be things tried. So there's a lot in front of us. There's more in front of us than there is behind us. This is going to dominate the midterm elections. This is all anybody's talking about because it affects so many people. So get ready to weigh in your communities, talking to your friends, talking to your neighbors. One thing everybody in this room has in common is we're our family experts on healthcare and how this stuff is delivered. Doesn't everybody ask you all these questions when you're having a family dinner? I see some heads nodding, right? They all ask me. I know they all ask you too. Unpopular things rarely stick. This, I think, is a huge takeaway. It's sort of this blip on the radar, and then over time, unpopular provisions almost always peter out. So that's not telling you by any means that we should ignore them or try to wait them out. What it means is that take a deep breath because we're going to ride through the storm together, and there's going to be enough changes to the environment that we're living in that it will look different in a couple years' time. A lot of action in the courts. We're going to see, you're already seeing it, right? You see suit after suit after suit after suit, challenging provision after provision after provision after provision. Every one of those has a long track to go. And what is it, 5-6 years on average before an initial lawsuit makes it to the Supreme Court? And you know in this environment, every one of these things is getting a cert petition written for the Supreme Court. Nothing stopping short of that. And advocacy. So I know there are really key, strong, excellent advocates in this room. I know some of you from a former life and current life. And your job is more important than ever. You must advocate, you must tell the story, you must bring data and numbers, and it can't be just feelings and anecdotes. You have to bring the hard stuff to bear, and we have to tell the truth. We have to speak that truth up and down the chain of what the impact of these types of acts are. Right, health plan people are thinking about, they literally have to end coverage for people. Health center folks are thinking, we need to really think about how we're going to manage your pharmaceuticals because you have to pay them out of pocket rather than you being covered by Medi-Cal anymore or an Affordable Care Act plan. Our community organization partners have to think really seriously about how you continue to provide the add-on and wraparound services that deliver the promise of health within community. All of those things are real, and we have to quantify and tell those stories to the policy makers who matter. That's going to shape the future. That's all there is to it. This is for you to take home. Again, this is there's not enough coffee on that table back there for us to go through this one together. But what this slide is meant to show you is all of the pieces, and these are just the major ones. This is all of the various provisions that go into bringing HR 1 to life. And the provision number is right after each of the lines. But you can see, look at the two black boxes at the top. That's the really interesting part too. Look when some of the really key provisions take effect. After the midterms, after the next presidential. Those are important things to remember because those give us milestones for planning for each of your organizations and for your community as a whole. Those give you the goalposts that you're aiming for in terms of what and how you have to think about the future. Because a lot of this stuff, right, that's to the left of the first black box is really some of the inside baseball pieces around operationalizing the law, right? I mean, FMAP changes and some of it is, headline grabbing things like blocking Planned Parenthood from participation, right? But then you get into the real meat and potatoes starts happening in 2026 or 2028 and onward, 2026 and onward. So the slides are going out, Ryan, right? Ryan, Sonia? So this will be available to all of you, so no need. And we can send it to you too if you'd like, if you want to drop off a card. It's already on the QR code, so you can get the slides already, so you don't have to take pictures of that. But when we come back after the break shortly, we're going to go through this exercise, and Dina and I are going to walk you through spending some time thinking about your future in these 4 areas. And Ryan previewed them at the beginning, and he's right on the money. What might happen, of the things that might happen, what of them are preferred? So there's a real fine distinction here, right? First, we're going to ask you to think about what is a realistic set of things that might be outcomes from living in this environment. And then of those things that are realistic, which of them is preferred? Because we're trying to get you to opportunity and to think differently about how we care for Orange County and the state and the nation. And once we know what some of those preferred things are, what are some concrete things you can do to make them happen? And the 4th thing is to really ask you to think outside the box, which is, how does this moment provide you with an opportunity to think about something differently? Because the one thing that challenge and change offer us is it offers us an opportunity to grab something different in front of us and to do something bold and do something that is truly groundbreaking and that really moves the needle and drives things forward. The HR 1 is a disruptor. And when we face a disruptor, the only thing we can do is disrupt right back. And so this is the chance to disrupt right back in the face of this overhaul and this upheaval. And we're not going to tell you what that looks like, right? Because it's going to be different for everybody in this room. But we are going to help you think about how you might respond in a disruptive way to a series of disruptions that's coming in front of you. And some of those things you might think about is who your patient population or the people you serve, who are they? Who are they really? And put them down on paper in front of you. What do you really do? Can you break that down to 5 words or less? Because when you break it down to 5 words or less, you get to the real core of who you are and what you're doing and how you're changing the world in your little bracket. What are the financial considerations? Do you have the financial ability to do something different and to change the way you do things? That's a serious question that only you know the answer to. I don't think you have to answer that one out loud, but you know what your position is. And I'm going to ask you to hold a mirror up and ask yourself honestly and bluntly, do we have what it takes financially to weather this and to make the change that we need to make? Physical infrastructure. A lot of our physical plants and our facilities are well past their useful life and are no longer able to meet the need. What are those types of changes that you need to make? What are the rebuilds, and how does that fit with a reimagined approach to taking care of your community and your beneficiaries? What is the leadership you need? Do you have it? Are you it? We look ourselves in the mirror and say, yep, I'm ready to do this. There are some people I know, and I come out of the community health center world. There's a lot of people I know in that world who are deciding this is their moment. They're going to pass the torch, and and that they have built to today, but they're going to pass it because they can't go through it. And they don't feel that they have the skills to serve their community in the right way. That's one of those things that I was suggested to ask a tough question. So I'll leave that to you to ponder in your own time. Your workforce. We talk about workforce constantly within our market, but again, break it down. Look in the mirror. What does that really mean? If you're going to do something differently, you're going to need a different workforce, and you're going to need different people to do it. To our student leaders who are studying this, right? You're sitting at this cusp. You're at the cusp of learning. What are the things you need to learn differently to meet a disruptive moment and carry this torch forward in 5 years, 10 years, whether you end up as a physician or in some other kind of path? Think about your reputation, your brand promise, and your partners. What are they? How do they live? How do they change? Think through what this means. What is your legacy? Who have you been? Where did you come from? What are all those things? What are you known for? Maybe those change. Maybe they're the same. Some of it is, I think we can't be afraid to think of this minute in our history. We have a chance to be living at a time that lots of things are different. So we have a chance to change with them. Revolutionary action, right? I was struggling to find a good example of this, but there are a couple, right? We saw them happen at COVID. We saw them happen at the rise of HIV and AIDS. And we saw massive changes in organizations that said, wait a second, this is, I'm not going to use the word, this is a freakish change to the world we live in. And so we have to meet that. To do that, we have to make a hard right turn in order to make that change. And we have to take some serious action to get there. Streamlining, opportunity, right? These are all areas that I think we've been hearing talked about for a long time. And this is another chance going forward to think through this, because the support structures are different. And they're going to be different. The talk about caps on administrative expenses, and there's an act in the California legislature that's being talked about around limiting community health center costs outside of direct medical care. And there's similar actions at the federal level talking about what the nonprofit sector has done in the past. And we understand those of us who've worked in that world understand the efficiency model that we live under. And it's different than from a for-profit sector model because we have a different business goal, right, at the end of the day. But these are all things that are on the table and are forces that are causing even more disruption in the environment that we're living in. So this really takes us to the end of this part. This is really the moment for something bold. This is the chance to do something radically and totally different than you've done before. You might start something new. You might close something down. You might find a partnership with somebody that draws you closer together in a way that streamlines both of your organizations, but delivers on a common purpose and a common outcome for the patients who are and the beneficiaries who are in front of you. Some key relationships you might have to renegotiate. There's what's that line? 80% of people who survive plane crashes get a divorce. This is like a plane crash. We might end up in some different relationships when we come out the other end of this upheaval. And that's okay. And it's okay to do conscious uncoupling and rejoining and finding new alliances that serve and deliver things to Orange County in a way that they haven't been delivered before. Infrastructure simplification. Oh my gosh, can we get ourselves out of our own way, please? Just a little bit. If you can go home and find one thing to cut in your administrative simplification, everybody wins. Everybody wins. And so I encourage everybody to find one thing you can change when you get home today. And then really the thing that nobody really wants to talk about, probably not everybody in any room is all going to be there at the end of this. And one of the ways to do that is to own your destiny and to do this in a planful way rather than having it done to you. And that I can't say strongly enough. If you look in the mirror and you analyze as governance, as leadership, and you say, there's no role for us in 5 years. There aren't enough dollars, there aren't enough whatever it is to have us in position to continue doing and growing and having the highest possible quality outcomes and serving people from the heart and really making that come true, then as stewards of that mission and of that outcome, we owe it to ourselves to protect the legacy of the work that we're doing and make sure it continues. And we can do that planfully and in a way that ultimately expands opportunity for beneficiaries rather than shrinks them. So that takes us to the next phase. So I think I'm to call Ryan back, is that right? Yeah. Ryan's presentation is flashing in front of my eyes here, but I'm going to give him the microphone back. Thank you for the nods and the smiles, and it's so nice to see great friends, and we'll be back after the break. Ryan.
Thank you, Warren. So I just want to sum up a few things as I reflect upon hearing Warren speak and so eloquently. And just really, I think at the end of the day, I heard three things. One, plane crash, divorce, and opportunity. I forgot unprecedented. So, so with that being said, I think that there is something to this, right? I think we've heard what we know. This is something that we have in some ways experienced in the past, right? This is not really, if you really break it down, it's really not anything new, right? So for those of us who've been around, I don't mean to date myself, but we've been through those work requirements. We've been through this redetermination every 6 months. So again, I want to say that we're in good company. It really isn't anything new. And, I think, Warren, we kind of started off with the conversation today too, was it's okay. And this is the place to be vulnerable. And if you're going to be in a safe space to be vulnerable, this is probably one of the most safe places you can find. The reason for that, obviously, is so I think at the end of the day, this is also an opportunity. We have an opportunity to think big, to think bold, and to take this challenge and really think about how we, at the end of the day, stand still by our moral compass. And then lastly, also think about what are we doing in benefit to our patients and to our staff. So at the end of the day, that's kind of what we're thinking of in that sense, is just think of this as an opportunity. I think nothing's off the table, and it can even be something very, very small that may have great impact later. But again, start with something and just be able to kind of share and connect. I would engage you all, especially if you're at tables of mixed company, please use this next sort of opportunity right now. We're going to do what we call a networking bingo. So you will have bingo cards on your table. We encourage you to get up and to interact with each other right before we start getting into this sort of deep dive and really think about the opportunities that lay ahead for you. So we'll give you guys 10 minutes to complete this. There are prizes. So not to say that it is going to be just you get a goal of this is just to understand it's just a network. There will be prizes. So Sonia, 5 minutes, 10 minutes? 10 minutes? Okay, great. Thank you. So thank you all for reflecting on the keynote and also for glad that you were able to make some new connections or reestablish other ones through our networking bingo. It seemed like everyone was engaged. We were able to handle all the prizes, so that's a great thing. So again, as we think about building on these insights, we're really now ready to shift as for the meat of today is really about scenario planning. This session is going to be thinking about strategically anticipating challenges, exploring different possibilities, planning with intentionality, and really thinking at the forefront for the communities and the populations we serve. So to lead us through this, I'm going to welcome back Warren to this stage. Warren, thank you again for guiding us through this process.
Thanks. And it was really fun watching everybody circle around, and I can only hope that the feedback was positive. So we are going to start. Let me bring this up. So Dina and Sonia are going to pass around one of these. This is, I know, really attractive, isn't it? This is, I'm not a graphic artist, so this is what you get with me working on a computer yesterday, putting it on paper. And so I'm going to ask you, this is like serious audience participation time. So no more listening to me. I'm going to sort of kick off sort of each of the four sections. And what we're going to do is take, work in whatever natural groups you have together. But I'm going to ask you this is an individual exercise, right? This is just for yourself, but put some ideas down on paper. But I'm going to challenge sort of from the end of the opening conversation. I'm going to challenge you to put some things down on the paper that are maybe something you've sort of been almost afraid to confront, something that's really bold and disruptive and different. That, there's a thing that like nags in the back of your mind, like, ooh, I wish I could find some time and space to think about this one little thing. Well, you can find it, and this is the time and space, and it's safe and it's private, and you don't have to share this piece of paper with anybody if you don't want to. That's the beauty of it. So if you want to work alone or in a natural group, and I know some are like groups of people from the same organization together, the choice is entirely yours. You can even just work with a friend if you'd rather, a safe partner to think about it. And over the next, 40-ish minutes or so, hour, more like hour, we're going to go through these four columns and talk, and I invite you to add to the conversation as we're thinking this through, talking about sort of the possibilities and what the columns mean, and then give you a few minutes to sort of think and reflect and talk with each other about how you might add some things onto this worksheet in front of you. So if you remember, we talked about what might happen. And so I'm going to ask you to take just a minute and with everything you know about the things that we're absorbing and the changes that are happening in our environment and marketplace, what are some things that you could envision being an outcome from that? They can be negative things, they can be positive things, they can be anything. But what might happen? Let yourself think a little bit differently and freely. If you glance down the pike 6 months, 12 months, 2 years, what does the world look like? Make some notes. Anybody have any thoughts they want to throw out as something to jumpstart thinking? I know enough of you by name I could call on people, but I won't do that. I was very briefly a high school teacher. It was a disaster, but but I still have a few of those skills, right? And the teacher really could see everything that was going on in the room. So just note to self. But think. give yourself a moment. Remember that list? It's at the bottom of your page, right? So you have the people you treat or serve or care for, the services you do and how you deliver them, and your finances and your infrastructure. All those prompts are at the bottom of this page. So give yourself a minute or two or five, and start jotting down some outcomes of what the world might look like in a couple of years. And Dina and I can wander around and help you think through and answer questions or whatever. And get more coffee, jump up whenever you need to. It's coffee and connection. So we like both of those things very much. And we'll be back up here in probably 7-8 minutes. But think about it and, shout out. I want to hear some noise in here. And one piece of feedback I was given was that what a lot of things that folks wrote down in the what might happen column tend to be a little more on the doom and gloom side. And that's okay. We're living, we're living in outre times, so we have to think a little bit differently. And I understand, and I think we all understand with each other, the sort of natural tendency to think about some of the negative things that might come out of the changes that we're witnessing firsthand today. But there's that saying, I might have said it earlier, right? Even broken clocks are right twice a day. So there are some things that are happening in this world, right? I was reminded this morning on a radio broadcast about it was my spouse shared something this morning about, being able to be totally on board with healthy eating and a healthy diet and eating more fruits and vegetables. I mean, anyone who disagrees with that, I think we can look differently, but that's a point of common ground. And so, right, if one of the outcomes of all this upheaval is that there's advanced messaging and there is financial support for community gardening and CSA farming and things like that, right? That's a preferred outcome that I think we can all get on board with, because I think everyone does agree that people eating more fresh fruits and vegetables is good for health overall. That's a non-controversial statement, I hope. So that's a prime example of one of the outcomes. Now, somebody is going to say that was suggested during the Obama administration, and that's 100% correct. That was a main goal of Mrs. Obama. I used to be the vice chair of Mrs. Obama's urban health initiative on the south side of Chicago. And, one of the things there was about healthy eating and availability of fruits and vegetables in food deserts. And everyone remembers she planted a vegetable garden at the White House that's now paved over. But and it's not commentary, but it is but that's a prime example. If the MAHA movement has a factor that's around nutrition and dietary choices, then we can key in on that together and work to bring that about. And we can use that hook to advance the rest of our community service agenda and the rest of the things that we're doing to make Orange County healthy again. And so I want you to go back through your list now that you have. And if you think about those things that you identified as things that might occur, which of them are the ones that you would like to key off of and work into your strategies? Because there are nuggets there, and you might have to tear them apart a little bit, but you're going to find something. Think about the executive order on homelessness that came out of the White House, right? Probably, I saw a lot of the commentary and read a lot of the pieces around a return to civil commitment and things of that nature. However, with all the investments we've had in CalAIM and CS and things like that here in the state of California, it all is in the service of the same goal, which is having fewer people living unhoused. So what do we have an opportunity to do? We can cut the legs off of that EO by getting people into stable housing, right? So think about how we can rocket forward and what outcomes of this moment are there that you can key in on and harness to go where you want to go and go back to your groups. And I think it should be a little bit louder. So don't make me make everybody get up and dance, because we can do that if that's what you want. So we'll be back in just a couple, and Dina and I will keep circulating. So flag down if you have any questions. We're happy to join you. Did we all pick one or two things that might be okay? Preferred from the list? Just to, by process check, we're going to rocket through the next 2 cycles of this, but then we're going to get into serious audience participation. So start thinking about what you might want to share, or thoughts or ideas. So get ready. The third section right now is about what you can do. So this is pretty interesting. So taking those preferred things, we're going to give you a few extra minutes on this one. So this is action. What are a couple of things you can go home and start doing on Monday that bring about those things that you want to see happen? What can you do? Wow, that's really quiet. But there's something you can do. There's something you can start back at your desk on Monday morning. I won't make you do it this afternoon, but you can take the weekend and think about it. But you can do something different on Monday that starts moving you down the path towards responding to this aberrant moment. So, okay, there was so much conversation just a minute ago. So there we go. Thank you. Now for the hard one. And I'm going to really ask you to step outside your comfort zone. We talked about fruits and vegetables. Oh, funny sentence. We talked about fruits and vegetables and healthy eating. We know there are chances in outreach and enrollment. We know that there's alignment on fewer people living unhoused. There's a lot of areas in which the MAHA agenda meets regular care, chronic disease focus. What do all the health centers in the room do? You do chronic disease, right? Maternal care, care for pregnant people, newborns. This is top of the agenda. There is total alignment at what's coming out of HHS and what you all do in health, in social services, in the team, the folks here who are adjacent to healthcare delivery. So in the remaining just 5 minutes, I want you to find one thing that you've heard about in that agenda that you can say, you know what, this is our anchor. This is the thing that we're going to focus on. Is it the unhoused? Is it food? Is it maternity care? What is that one thing? What's the possibility? But if you were looking at your board or your coworkers or your family, and you're going to shock them by saying, I looked at the agenda and all the upheaval that's in front of us and the work that we do, and I found the one thing that we can focus on and use as our anchor, and you've got 3 minutes to write that down, and we'll be right back. And then you're going to share it. Hey, this has been really fun. I hope it's been fun for you. It's been fun for us. We get to watch. It's nice to watch other people work for a change. But I want to thank you for sort of playing along, and thank you for sort of getting out of your mind's own way for a little bit this morning and thinking a little bit differently about some stuff. Does anybody have an outcome or an aha that you can share or you'd like to share with the group? Some of the folks are around with microphones, so we get it on the recording, but I'd love to hear at least 2 or 3 takeaways of, things that you wrote down. It is warm in here, isn't it? Great.
Thanks for having me. I'm Janet. So we talked a lot, and we were thinking just get rid of insurance companies altogether. Cash pay. But I'm serious. So maybe make it where people are getting services with cash that, reasonable rates, not these outlandish amounts.
That is definitely out of the box thinking. Can't argue with that. Thank you, but thanks for sharing the thought. Let's have. I think there's a lot of people who would like to see. I don't think we're going to see insurance companies go away, and that's one could make a strong argument of why that would be really cool. There's another strong argument about just the way it takes a lot of money to provide a lot of healthcare, and insurance companies actually do a lot of things around investment and utilization management and making sure that there are resources available. So there's a balance in all things, but I think the takeaway is really disrupting finance of care. That's really that's what I hear as a takeaway there, and that's a great headline grabber, and I love it for that. Absolutely, and I think there's something to be said. I live in the desert, right in Riverside County, and almost all primary care is out of pocket out there. People don't. None of the clinicians take insurance for primary care out in the desert. So you join up. It's almost like a co-op or a collective, and you join up and you pay dollars. So there are definitely examples of we have Blue Shield. Dina and I have Blue Shield coverage through our employer, Blue Shield of Michigan, and that's accepted out there. But really, it's only accepted for hospitalization and lab tests and ancillaries. And we all end up paying out of pocket out there for care like that. So your idea is not insane. I'll throw that out there for sure. It's happening in other ways. It's happening in Central LA already, outside of the Medicaid space, of course, but it's happening. That's happening in some areas already. How about another example? Thank you for sharing that. We're going to go to this side of the room. Just one thing. What can you take home? There she goes.
Why did I get voluntold? Okay, so hi everybody, Bridget Cole. I was at the table with a plan, so I kind of can't throw my hat into that. But and others. I think one of the through lines that we had talked about was find and communicate a condition where there's enough threads across missions for partnerships, and articulate it like an epidemic. We have an epidemic of homelessness. We have an epidemic of nutritional disparity. And so if we articulate it that way, then how can we pick and choose the bright spots of partnerships?
I love it. Thank you. Thank you, Bridget. That's excellent. Thanks for sharing that. Let's do one more, and then we're going to get out of your head because my thing is red. How about one more?
On the same conversation, kind of like them, we have various clinics at St. Jude, and we are in dire need of neurologists and urologists that our patients need. We have no place to refer the uninsured. So we were talking about building partnerships with providers that are willing to see uninsured patients.
Great. Thank you. And thanks for finding that thread and through line. Those are just 3 prime examples right here in your community of ways that we can organize things differently and we can think out of the box and try something new. And I hope going into this has been kind of a rough week in health communication in our country. So, I hope we can take, though, that there's just 1 minute, and thank you for spending these couple of hours with a little bit of optimism, because there is a chance to do things that are different. So thank you for having me and us, and thank you, Dina, for helping out and your relationship here and team at the Coalition. I'll give it back to Ryan and hope to see you again soon. Have a great weekend, everybody.
Well, thank you, Warren, for guiding us through that session today, sharing your expertise, as well as Dina for doing the table walks and just advising and providing guidance as we need it. At this time, we really wanted to offer you the opportunity, if you have any other questions or reflections that didn't come up, maybe in scenario planning, that we'd want to bring forward. So if you would like to suggest a question or have something you'd like for the greater conversation of the group, can you raise your hand and we'll bring a mic to you? You can kind of share your thoughts or questions with the group. Again, collective space, safe space. Okay, well, hearing none, I don't want to prolong it. That's fine. I wanted to then recall back to what's on your tabletop. Again, we definitely do have two QR codes. One is for today's participant materials, and the second item is for the evaluation for feedback for today. So we really encourage you all to take and participate with both downloading the content, but then also providing your feedback and your thoughts for today. We definitely do take that to heart. We definitely do use that in our thinking and planning for the next event as well. So with that, just want to thank you all for attending today. Again, if you have any other questions, or please feel free to contact us outside of this meeting. But again, thank you all. Thank you again to our speakers, both to Warren and for Dina, for joining us from HMA, getting us their expertise and their guidance today. So again, thank you. Safe travels.